We welcome Dr. Jaya Goel,
Thank you.
Chinese, chapter 7 and 8, 5 and 6, 7 and 8.
7, 8.
Yes, I'm sharing you. Uh, oh, share कर रहा हूँ. Chapter 7 share.
Yeah, shared.
एक second. Oh, sharing.
So I start.
Yes.
Hmm. Chapter 7, Law of Z Cleft Points or Accumulating Point. Each of our 12 paired meridian have G cleft point, accumulating point. The these points are and these are the points where the energy is stored. Acute or chronic diseases are treated over here, and meridian of the meridian as well as the concerned internal organ. Means internal organ disease of the on this point is treated on this point. Apart from some extraordinary vessels have and this some extraordinary vessels also have these cleft point and which accumulate which treat the as well as the it means that the cleft point is used to treat the acute as well as chronic diseases of the meridian or the concerned mm, organ. And accumulating point or hung point is also is called because hung is the temple of in China. Great Buddha's temple are called hung. Means the energy level of this point is very much there. There is a storage of the energy, bioenergy. That is key over these points. They mm, and these points are called the temple of our human body. Zigzag point is are the gap in the body in the body because of the congestion or some of energy or any other reason, and then we get the energy from the cleft point. So the treatment on the cleft point affect the circulation of the bioenergy and the blood circulation also uh, with the deep bioenergy and circulation. Uh, if we treat the it treats the it is used to treat the chronic and the or the very old disease as well as the mm, acute disease and treatment is deep rooted. I mean, and for the so that the serious diseases also can be treated of the related organs. And by giving treatment on the cleft point, we can stop the recurrence of the disease. That means if there you have seen the patient with where the it's like a common cold or something that again and again recur. Like asthma patient, they have again and again. Then giving treatment on this, and that recurrence is completely will be stopped, so that the patient can live a healthy life. And these are the G-Clef points, meridian, and the treatment. Means the which point will be treated, which condition is treated by this point. Like lung meridian, G-Clef point is LU6. And treatment for the treatment of uh, contraction, loss of voice, hemophytis, and same way the large intestine, the Jiggler point is Li7. It is for the opposed, this the feeling of scent of seizure or uncontrollable hilarity. hilarity. It is for the and for stomach zigzag point is stomach 34 ST34. It is used to treat the painful breast cramps, convol- con- convolutions of the stomach. Means like burps and all, you can treat it. Spleen A, spleen 8, SP8 is the flap point of the spleen. You used to treat the pain of the lower back, preventing the patient further bending downward. Means for forward bending is restricted of these back pain with the forward bending restriction is the heart H6 is the left point flux and contraction with the impedation and apprehension. If patient is always apprehensive for any or something or other thing, then we should give the H6 as the treatment. Should give the treatment on H6. If you don't understand, we should give up tone or sedate. You can apply on methi only. It will also work. Yes, seeds also work. Small intestine, SI6. Treat the throat occlusion, cervical spondylitis, all kind of the vision problem, all kind of any type of the problem in vision is treated on SI6. Urinary bladder UB 63, cholera, shaking head with the open mouth of infant can be treated on UB 63, trembling legs, or This is the flap point of urinary bladder, UB63. N- K5 is the flap point of kidney. All the disorder of menses and short sightedness is treated on the K5. Means if the patient is short sighted, it is treated on K5. Pericardium P4. Hemorrhage from a different opening. Hemorrhages of different from a different opening like mouth, nose, ulcer, etc. Openings or hemorrhages on from this can be treated on P4. Triple warmer TW7. Convolution or the scissors of all type. Any type of scissor is treated by TW7. Gallbladder 36 GB36 is used to treat the pigeon's chest of infant. Pigeon's chest means the chest will be little bit looking like a pigeon side chest, like this. It will be like this, like pigeon with for swollen up a little bit. Pigeon chest of pigeon breast or chest of the infant, convolution, or and the epilepsy, dog bite, snake bite, all are treated on GB36. Liver 6 disorder of equation like constipation, bloody faces. If someone has having the passing blood in the faces, then the treatment should be given on liver 6. Yin linking vessel. This is the these are the vessels, extraordinary vessels. Yin linking vessel is the extraordinary vessel, and it is the K9. Treatment is given on K9. Patient curls and up and unable to stand or work the infection or then the treatment is given on K9. Infection or toxic affection of all kinds of epilepsy, and these are treated on K9. Wing madness and continuous salivation. Some people have salivation, problem of salivation regularly, protruding tongue of food or drug poisoning can be treated on K9. Next extraordinary vessel is the yang linking vessel, that is and the G flap point of the yang linking vessel is GB35. Paralytic tendency effect. So, I mean the paralytic patient, lower extremity, occlusion of the chest, throat, or with the feeling of suffocation is treated on GB35. Difficulty in swallowing, ulceration of feet is treated on yang linking vessel, that is GB35. Zig flap point of yang linking vessel. Yin heel vessel, zig flap point, it is also a extraordinary vessel. K8 is the Jiggler point of yin linking vessel and disorder of the menstruation and accumulation, excess of the menstruation, bleeding. If bleeding doesn't stop easily and it keep on increasing, then we can give treatment of K8. Problem of the urine and stool is also treated on K8. Young heel vessel UB 59, pain in the lower muscles mm, of the lower limb, preventing the patient to getting up without support. Then if patient is not able to stand by himself without support, need to lower leg muscles and is weak, and there is a pain, so the patient is not able to stand, then treatment should be given on UB59. Cholera is the cholera like symptom with the mm, scars and convulsion is additional symptom of this. Uh, this is not loin, it is joints. You can correct it in this joint. The pain in muscles of joints prevent the patient from getting up. It's not loin, it's pain. Getting up without assistance or with from standing from any length of time. Now, conceptional vessel, it is ST30. It balances the key and blood and temperature of the upper and lower body. It treats all the problem of ovary. Any problem of the ovary is treated on S, ST30. These are the things you have to learn. And, and now we come on the Leo connecting point, or law of Leo connecting passage point. Passage point is the uh, everyone knows that there is all are the paired meridians. Yin and yang is the paired meridians, and it is the connecting point. Leo connecting point is the connecting point of these meridians. Like small intestine and heart is the paired meridian of fire element. Then H5 and SI7 is the Leo connecting point of, and they combine these two meridians. Mm, every So Leo connecting point is the point which that's why it is also called a junction point. And these points are also called these passage point. That if the energy level or every couple meridian has at one Leo connecting point. The if the energy of a heart is reducing and it needs more energy, then if you give the treatment on H5, then it will take energy from SI7. Means it will take the energy from SI7, or means small intestine. If the energy of heart is reduced and the energy of small intestine is increased. So it is the way that one meridian can take energy from other energy, and another who has have a deficiency can take the excess energy from other meridian. And or you can say it will help in the balancing of the energy of the meridian. Please take the up. How it transfers? Now we come by passing the excess energy to the deficient energy organ. Leo connecting point is treated. If the like I told you, H5 the passage point of heart, and SI7 is the passage point of small intestine. Then if the energy level of the mm, if the energy level of H5 is low, and then it will take energy from H7, and if same vice versa, if energy level of SI in large intestine is deficient, then it will take from the heart, bioenergy from the heart. By applying the treatment on SI7, it will take energy from heart, and by applying the treatment on H5, then it will take energy from SI7. Other therapeutic and uses is that if there is any problem on the skin near the Leo connecting point of one meridian, then we can give the treatment of Leo connecting point of the coupled meridian. Like if there is some boil or skin problem on H5, near H5, we can give treatment on SI7. Mm. If the is energy is imbalance in two map, uh, paired and paired paired organ, then the energy can be taken by the organ which has less energy, and excess energy is transferred by the organ. If the some organ is some meridian is having excess energy, then it can transfer the energy to the organ who has less energy, so that so that we can say it can balance. It can balance the energy. It is one is that we can balance the energy on the organ. Uh, but it can balance the energy of the organ. प्लीज पेज को आप लीजिए. And it is also helping the balancing right and left. Means if the right side energy is higher and left side energy is less, then the left side can take energy from the right side, so it can help in the balancing of the both side meridian, same meridian. Mm. And fourth point for fourth use is that it is also help in the time. You have remembered that we studied in earlier that time clock. Then if the organ can take a midnight and midday energy from midday and midnight. Like if urinary bladder has a time mm, uh, 3 p.m. to 5 p.m. and lung has the time at 3 a.m. to 5 a.m. Then giving treatment on say this time, uh, they can exchange their energy, transfer the energy or exchange their energy on these two time. Uh, like urinary bladder has Leo connecting point UB58 and lung has 7 LU7, then it can help both to exchange energy on this time. These are the to balance the energy of both the organ. And these are the Leo connecting points and the meridians and symptoms. In which symptom where we have to give the treatment like lung LU7. Yawning means if somebody is having lots of yawning problem, then the LU7, we should give the LU7 treatment on LU7. It will take energy from large intestine so that for large intestine, cold teeth, stiffness of the diaphragm. We give the treatment for cold teeth and stiffness of the diaphragm. ST40, weak leg, excess cough, spleen, ascites, SP21, it's the great Leo connecting point. Means it a great Leo connecting point is the head, and by giving treatment on uh, SP21, we can treat all the meridians in one point. It will balance the energy of all meridians. And heart, weakness of bone and joint, and if patient of the body, all bones and joints and uh, of the body. And if the patient cannot speak, then also we can give treatment on H5. Small intestine 7, SI7. Burning eyes, if burning eyes treatment is given on SI7. Urinary bladder UB58, excess of water element is treated if there is a excess of water in water element in our body, then it is treated on UB58. Uh, K4 is the Leo connecting point of kidney. It used to treat the hyper emotion. Pericardium P6 and stiffness and inability of to turn head means this, like turning this is not easy for these patients. So P6 is the best point to treat this stiffness. Triple warmer 5 is the flaccid syndrome of the elbow joint. Treat the flaccid syndrome in elbow joint. Gallbladder 37, inability to walk means if patient is not able to walk, then a treatment should be given on gallbladder 37. Liver 5, genital itching. If somebody is having genital itching while it's too much genital itching is there, then the treatment should be given on liver 5. Governing vessel and the conceptional vessels, these are the paired, or these two poor vessels are the paired meridian, and GV1 and CV15 is the paired Leo connecting point. GB1 is treated, give a drizzling backache and mm, dizziness and backache. Means dizziness, patient is having dizziness and back pain, then GB1 should be treated. And if patient is having a skin disease on abdomen, then CV15 will be given, treatment will be given on CV15. This all, that's all. And the governing vessel and conceptional vessels are yin and yang meridian, and they are paired meridian. And SP21 is the Leo connecting point of all the point of the human body. Treatment is on the SP21 can balance the key of all meridians in the human body. So this is all about the Leo connecting points. Anything anyone want to ask can ask. Anyone want to ask anything in these two chapters?
Yeah, what is triple warmer? I saw the term triple warmer. Can you explain what is triple warmer?
A triple warmer is the meridian. It is not an organ. It is a triple. We have divided our body in the three warmer, upper, lower, and middle warmer, and it is called triple warmer. And this meridian they are guiding this. This is called triple warmer.
Fortunately, this is not an organ which is defined in modern science. It is a concept rather, phi- because it was a philosophical concept that triple warmer is there and it is controlling the temperature of whole body. There are three warmers: upper warmer, middle warmer, and lower warmer. Upper warmer is controlled by heart and lungs. Middle warmer is controlled by spleen and stomach, and the third, the lower warmer is controlled by kidney and liver. And in and you will come to know that this triple warmer has been said to be the endocrine meridian by Dr. Wall. So
Any other
you,
query?
yes, no question. Okay, sir. We please start the assignment, and there are questions in the book. You have got the assignment book. There are questions you have to answer. That's not in written answer is to be submitted before 15th of May. So you can start with multiple choice questions.
So I can take a leave.
Yeah. Okay, Jaya. Thank you.
Okay.
So this is the you please start at least if any question will be asked. We are here. 20 questions are given as multiple choice questions in each section, in each subject. So you please go through, and if there is anything we have to tell you, then we are ready. Pamela ma'am? So English nutrition. So, nutrition topic is taken by some other one.
Sure.
Okay, okay. We are to continue up to 14th of March. Up to 14th of March, we will continue this one. After that, the classes will be over, and from next 6th April onwards, for 1 month, uh, as plus classes will be there.
Arvind sir, is it
Yeah.
is it possible for you to do maybe sometime only meridians, the location of the meridians, the 12 meridians?
Uh, this one, Chinese meridian
Yes,
or Ayurvedic, Ayurvedic or Chinese.
both.
Ayurvedic meridian, I can tell you, but
Yes.
in complication is there at the level of spiral one. It is hard to be presented because the concept is there. Suppose, but it diagrammatically it should be shown, and we don't have any such system. I can tell you, I can tell you in my hands that this is 101, this is 1, this is 4, this is 2, and this is 3. But suppose depiction is there in diagram, I cannot show that. That's the problem. I don't have any system. It can be displayed. That's the problem. Otherwise, we can tell.
Hmm.
I the concept. I can tell you the concept, the whole concept of uh, on the basis of books. Ayurvedic meridian, I can tell you on the basis of books, number one, and the Chinese meridian on the basis of uh, point wise. The meridian goes here, there. This can be told. Everyone finds some problem when just go through, because you just start thinking of this one, that Chinese meridian are there in the book, and the concept, I can tell the whole concept. It starts from this place, goes there, and then it comes back, then just go. This I can tell you, but not point wise, because depiction is not, system of depiction is not there. How can I depict? How can I display? I can display only my on my hands. That is the problem. That is also problem of SPS. They cannot tell you unless they just go to Prayagraj physically. But Ayurvedic meridian, uh, I'll try my best just to tell you. the whole concept through books. Through books with pages, it is depicted in pages. So on the basis of that pages, I can tell you there are concept of meridians, long vertical meridians, vertical meridian, horizontal meridian, and all that. So we can study this one. I'll tell you one day. I'll tell you that this is horizontal meridian, and I start from 0 1 0 place from this one. This horizontal 1 0, and this is 3 1. This is 6, and 7 8 9 3 meridians here. So 0 1 2, between these two meridians will come, and here two meridians will come. 4 5 6 is there. Till 7 8 9 3 meridians will come over there, and that's why this horizontal meridian will be moved like one, this one. Vertical meridian 0 in between, 1 4 towards thumb side, 2 3 this side. So 0 1 4 will move this one. 0 1 4 5 6 5 0 1 4 5 8. The concept 0 1 4 5 8 one side, and 2 3 6 7 9 other side. So 2 3 6 7 9 this side, 9 on the back of it. This is concept of this Ayurvedic meridian. And a spiral meridian, which is, though it is difficult, but I'll try our best. Theory, on the basis of theory, is it clear to everybody, Pamela ma'am? Theory wise, is it clear to everybody? There are so many questions on theory based. So I wish to know. Yes, Kelvin sir.
Yeah, Dr. Alvin, you mentioned earlier about the 13 forms of fire in the body. I know you remember the 5 Mahabhuts, right? But
13,
I can't
13.
the 13 forms of fire in the body and the location.
No. This is philosophical concept. 13, every Mahabhut has got its fire. Because we say that every element is composed of, every substance is composed of 5 elements. Undoubtedly it is there. So this is their philosophy, that 5 Mahabhut are there. They have got their own Agni, their own fire. 5 fires are there. These 5 fires are there. Again, we just say that this body, when you study more than that, we say that Panch Mahabhut, these 5 Mahabhut, as well as 7 tissues are there, and three forces, Vat, Pitta, Kapha are there. They just reside inside your body, and they just control your body. So 5 tissues: Ras, Rakt, Mans, Med, Asthi, Majja, Shukra. That means the plasma, the blood, the skin, the adipose tissue, the bone marrow, and the ova, or the sperm. These are 7 tissues known as dhatu. So they have got their own Agni, their own fire. And one Agni, we just treat one Agni, very important Agni, Jatragni. Jathar means stomach. Jathar means stomach. That means the fire of stomach. That is, for common parlance, we can understand by through it HCl. So 13 Agni are there. 13 fire are there inside our body. On theory part, we should be clear. We should be very clear about theory part. Once theory is clear, sir, once theory is clear, practical is not very difficult. Not very difficult. First, I have to understand. Suppose there only only 2 minutes I'll take. Only 2 minutes because I have to join another at 7:30. Suppose suppose I say that you see that your skin is burning. There are rashes. Skin is burning. This means skin has got some more heat element, fire element. So what I have to do? What I have to do? We have to reduce Agni and we have to enhance the water. According to Ayurvedic concept, we have to reduce Agni and we have enhance the the water. Now, how can we do it? This next day I'll show you. These are just, we say this is lungs and LI. And what is lungs? Category wise, Akash. Akash. So Akash Shabd. And Akash is also covering. Akash is also covering. What is covering? Skin is also covering. So if we treat this one, this on this joint, we will see, show you on this joint. If we just what we can do, we can on this joint we can tone 4 and we can sedate 3. So on the basis of treatment over this joint, we can reduce the Agni. This is the concept on the base treatment basis. Okay, next time. Today I have to join at 7:30 one more class. So I just, okay, thank you. Namaste, good evening, good morning, good evening, all that. Okay, Pamela ma'am, I'll tell you. Thank you.
Namaste, good evening. Thank you.
Thank you.
Oh.